All right, well, thank you so much. We are going to continue our conversation looking at NCDs on another one that really does not get the attention that it probably should, and that is psoriatic disease. And I'm really delighted to invite to the stage our partners from IFPA. We have Frida Dunger, the Executive Director of IFPA, and Kate Reynolds, who is an IFPA ambassador. And if you're not sure what IFPA stands for, it's okay. It's the International Federation of Psoriasis Associations. So I'm really delighted to have you, Frida and Kate, here today for, I think, what is really critical in that we are centering people with lived experience in these conversations as we're talking about how we should create policies for treating NCDs. We need to make sure that those people are part of those conversations. So I'm really delighted we have you here in particular, Kate, as an ambassador to be able to share that experience with us. But Frida, first I'd like to just kind of kick off. First of all, how many people here feel like they're really aware about psoriatic disease and symptoms? So, okay, just a few hands here. So I think we got a lot of people here who probably would like to learn more. So Frida, I'd love for you to also just set the stage around this disease, put in a context of how many people it impacts, and why you also think it's so important at IFPA to be including people who are living with these conditions as part of these conversations.
Thank you so much, and thank you for being here, and especially thank you to all of you that are here and not knowing about psoriatic disease. I'm really glad to talk especially to you. So psoriatic disease is a NCD, and many people mistaking it as being something that is only visible on the skin and therefore also something cosmetic. So being here today is definitely to talk about how it is also associated with other NCD comorbidities. So for example, mental health that the team here talked about just before us, diabetes, cardiovascular disease. So around the world, there are more than 60 million people living with psoriatic disease. And we say psoriatic disease both by meaning psoriasis, psoriatic arthritis, but also all the comorbidities that are associated. So it's a very complex disease.
Thank you. And so, Kate, you're here this week as an ambassador to really able to bring a face to these conditions. And for the high-level meeting that's happening on Thursday, and the policymakers are gathering to come up with their plans, what would you like to say to them about how they should be, incorporating your voice and experience as they think about how to address NCDs?
Well, I like to start by saying that I feel like my voice is a little bit privileged. So I want to emphasize that as much as my challenges with psoriatic illness and GPP, I'm incredibly fortunate to live in Canada and also have private health insurance and be in a professional position in my work life. My mother worked in hospitals for years. I had the best supports, and it was still a horrendous experience. So I really want to think of the people who have a more difficult time. And I'm so grateful to be able to share my story, because when this first happened, folks said, "Didn't you have a rash?" Meanwhile, they aren't expecting a 3-day hospital stay, losing 70% of my skin, or having to be on IV fluids to make up for it, not to mention recovering from the treatment.
Yeah, and when you think about, what's the impact then on your daily life, and thinking about, the ripple effects of this?
Absolutely. Well, there's the anxiety that's from the inflammation, but also the anxiety from not knowing when another outbreak's going to come, since mine are nuclear. And, you can't wear clothes, you can't work. You have to be able to function in your body to go to work. You just do. And so there's the loss in so many ways.
And as you mentioned, yes, coming from Canada, particularly as an American, I also see that as very privileged with healthcare. But do you think about the challenges that even particularly people in low-income countries have in getting healthcare? But what are some of the challenges that you also face that you feel like maybe aren't fully appreciated by the people who are at the policy level?
Absolutely. So one of the policy levels that can affect things is doctors, when they treat something, they have a reason that they choose the medical route they want to go, but sometimes the private insurance, in Canada, most of our medications are only covered through private insurance, and they want to cover the cheapest option. So I've been told that I've been treated with a hammer and I could have had a scalpel. And then after you recover from the illness, you know, not dead is a great outcome for what was happening to me, but it's not, you know, there's a world of difference between not dead and thriving. And now, in the years since my outbreaks, I'm healing from having to have been treated with such high-dose steroids for so long.
And Frida, you know, as you think about the high-level meeting on NCDs, you know, what are you hoping that policymakers will take into account, and particularly a lot of the work that you're doing on advocating for patient rights?
I think definitely listening to people living with the diseases. So the lived experience is something that we see very crucial, to have that holistic care as well. Kate, you were giving the example now with a hammer. Of course, we would all prefer the scalpel to just take away that issue. And that is exactly what we learn when we talk to people living with the disease. Last week, I was taking part of a scientific conference on dermatology, and they had the same discussion there. It's almost like a pyramid where you have to start step by step, as you were saying as well, the cheapest treatment, or maybe this could work, maybe not. But what if we change that pyramid and instead gave the treatment that gave the biggest impact from the beginning? And if we were doing that, the person living with the disease might not also in that time develop comorbidities or having other challenges. It's definitely possible to make an economic argument around that as well.
Absolutely. I mean, when you don't give somebody the best possible treatments, not only do they not get the best possible outcome, they miss time at work. You know, there's all kinds of economic losses, not to mention the fact that I am now on some really expensive medications trying to undo the harm of the other medications. So, you know, a lot of times I feel like we're treated like a series of illnesses, and it's not considered that we're an entire person with entire lives, and even maybe more than one non-communicable illness. Or, you know, you can't just treat one part of a person, you have to treat the whole person.
I can also add that it's reported that 82% of people living with psoriatic disease experience stigma and discrimination. And of course, that in itself can have an impact on the mental health, but it's also the inflammation that is caused by psoriatic disease that also have a negative impact. So 49% report back that they're having anxiety, and 25% has been diagnosed with depression.
Yeah, and I would love to hear, Kate, you know, how would you design your kind of dream healthcare system, or what do you see missing that would make your life just a lot easier?
I would just like my doctors to know that whatever they prescribe, I'm going to get. And, you know, I've had more than one doctor tell me recently that insurance companies can be their biggest barrier to care, and that's just devastating because we lose so much. And where I live, some healthcare is covered by the government and some private insurance, and they don't always think holistically in terms of the cost of another provider may have to pay. So it's substantially more costly, but it's spread out over different payers. So that single payer really keeps things honestly cheaper in addition to being more effective. It's devastating that it can be more expensive and less effective at the same time.
Yeah, so, you know, we had a conversation earlier today with Vanessa Carey, and she was taking a very pragmatic approach to investing in global health. And, you know, I think you're saying it's a pragmatic approach in the fact that it's good for economic growth, but also good for patients. And Frida, as you know, your work in doing advocacy, you know, how do you see this landing with policymakers of being able to make both that economic argument as well as the moral argument for how to provide better support?
Well, I think it's moving way too slow. IFPA had a global report on psoriasis done 9 years ago and a resolution 2 years before that. And since then, we have seen a lot of progress, but we're definitely not having that holistic care that Kate is longing for and need. So it's almost like having this complex disease. You need to have so many different experts that you are in to deal with. You maybe meet your dermatologist and then you have 7 minutes, but do I bring up my mental health here? No, maybe I should wait with that. And then the rheumatologist for the pain in the body. And there are so many different experts that should be needed or to be involved. And we have a long way to go before everyone knows about that.
Yeah, Kate, maybe you can talk a little bit about that experience and what that's like for you.
The experience of
Going to the doctor and feeling, okay, I've got this limited time. There's a lot of things I want to talk about,
yes.
and how do you balance
Absolutely.
that?
Well, I'm incredibly privileged to have doctors who've taken special interests in my cases. But every time I get that gold standard above and beyond healthcare, I think of all the people who don't have it. I think, I'm incredibly fortunate, or I wouldn't be here speaking to you today. But, how do we make it so that other people have the same positive outcomes? And it's complicated. I think, we need more healthcare providers. I don't have solutions, but it is a challenge, and I have a lot of doctor's appointments to get through everything.
Well, if you were to be able to kind of give one message to the people in this room, but also the people who are gathering an official high-level meeting on Thursday around how to incorporate psoriatic disease as I think not as well known, but also how to incorporate patient lived experience in their plans. Kate, I'll start with you.
I think it's amazing to me what healthcare providers don't see from their patients sometimes. And just hearing, they see a list of symptoms, but they don't see what that looks like in a person's life, the ways we have to limit ourselves to avoid having future outbreaks, the stress of navigating a complex system while having issues from the illness. And I just wish they could sort of zoom out a little bit and imagine what it's like not to be thriving and what it would be like to get back to where you want to be.
Yeah, I find they can be very challenging to navigate if you're at your top health. So, Frida?
Yes, I would like to say stop the domino effect. And that is really the name of our campaign this year, which we are tapping into the UN high-level meeting. So it means that we need to stop it now. And we know that treating psoriasis early and with treatment that actually works from the beginning can help stop that domino effect, can help stop other comorbidities to develop. So to increase that knowledge among you that are here today, and I'm hoping that will make a positive and a difference for the people living with the disease.
Yeah, thank you. Kate, any final words you have?
Just thank you for listening, and understand that, this diagnosis and access to any care is a privilege. So I just hope that everyone gets it, and that things are better. And I meant to say this sooner, but one of the things that really troubles me about psoriatic illness is the way that there are discrepancies based on skin tone. And I am the exact sample image. I'm pale and flush easily. I'm very easy to see it on. And I wonder sometimes how many people are missed because they don't even know what treatment they need, let alone being able to access it. And I want good outcomes for everyone.
Yeah. Thank you both so much, and thank you to IFPA for helping us bring this important issue to the stage.
Thank you so much. And please join us downstairs where we can play the dominoes and talk more about psoriatic disease. Thank you.
All right, thank you.